Bleeding after endoscopic sphincterotomy or papillary balloon dilation among users of antithrombotic agents. Introduction. Endoscopic management of bile duct stones is recognized as an effective and less invasive non-surgical procedure. Endoscopic sphincterotomy, EST, or endoscopic papillary balloon dilation, EPBD, are usually carried out to facilitate stone extraction. Although the safety and efficacy of EST and EPBD have been widely reported, bleeding associated with sphincteroplasty is an inevitable complication owing to the nature of the procedure. Despite intensive care, by means of transfusion and endoscopic, angiographic, or surgical intervention, severe bleeding is potentially lethal. Although the definitions of bleeding vary considerably in the literature, the rates of clinically significant bleeding associated with EST and EPBD have been reported to be 1% to 5% and less than 1%, respectively. Antiplatelet agents and anticoagulants are being increasingly used in the prevention of cardiovascular and cerebrovascular disease in developed countries because of their aging populations. Theoretically, EST and EPBD in patients receiving antiplatelet agents and/or anticoagulants can increase the risk of severe bleeding during and after the procedure. To date, several small retrospective studies have reported conflicting results on EST-related bleeding in patients receiving antiplatelet agents, and there are no available data on EST in patients receiving anticoagulants. EPBD is preferable in patients with coagulopathy based on the recognition that this procedure is less susceptible to bleeding than EST. However, this question has rarely been evaluated in patients receiving anticoagulants. For these reasons, there has been no consensus on the management of anticoagulants in the peri-procedural period of EST and EPBD. The authors were therefore motivated to conduct a retrospective observational study to elucidate the impact of antiplatelet agents and anticoagulants on procedure-related bleeding. Hamada et al. Did so using large-scale data derived from a nationwide administrative database of inpatient care in Japan, the Diagnosis Procedure Combination DPC database. Background and study aim. Severe bleeding is a potentially lethal complication after endoscopic sphincterotomy, EST, and endoscopic papillary balloon dilation, EPBD, for cholelocholithiasis. This study aims to evaluate the impact of antiplatelet agents and anticoagulants on this complication. Patients and methods. Patients who underwent EST and EPBD were identified in a Japanese nationwide administrative database covering 1,090 hospitals. Adjusting for other potential risk factors, Hamada et al. Evaluated the association between oral administration of antiplatelet agents and/or anticoagulants, continuation, discontinuation, and non-use, and clinically significant bleeding within 3 days of the procedure. Results. In total, 61,002 patients were analyzed. EST, 54,493 patients, EPBD, 6,509. The rate of severe bleeding was 0.8% in both groups, but EPBD was performed more frequently than EST in patients with chronic renal failure, liver cirrhosis, and in those receiving antiplatelet agents or anticoagulants. The impact of continuation, discontinuation of antiplatelet agents on severe bleeding was not statistically significant in the EST or EPBD groups. The use of anticoagulants was associated with a statistically significant increase in severe bleeding compared with non-use for EST, 1.6%, 27 of 1,688 patients, versus 0.8%, 429 of 52,805 patients, adjusted odds ratios, OR 1.70, 95%, confidence interval, CI 1.10 to 2.63, and for EPBD, 3.0%, 8 of 263 patients versus 0.7%, 46 of 6,246 patients, adjusted OR 2.91, 95% CI 1.36 to 6.24. Conclusion: EST and EPBD can be safely performed in patients receiving antiplatelet agents. Users of anticoagulants are at high risk of bleeding, and the peri-procedural management of these should be further investigated.